Turning around the economy and creating jobs are rightly at the centre of this election campaign, but it is important that other issues receive proper attention as well. This morning I would like to talk about my party's policy on health and to set out what I think are stark and growing differences with the proposals of the opposition. As I said on Monday when I launched our Real Plan for a Better Future, we're making no new spending commitments whatsoever during this campaign. There are no gimmicks and no vague costings. It should be noted that no credible question has been raised by any party about our fiscal plans. They are standing up to scrutiny because they show a comprehensive and credible way to sustained recovery for our public finances. Health is not only an important issue, it is an emotive issue. Every problem in the health system, and there are many, can have an impact on people when they're at their most vulnerable. The challenges faced by the health system have also increased in line with the reasonable rising expectations of the public it must serve. Fianna Fáil policy is that we believe in a strong public health system, one where the impact of public funding is maximised, where services are as close to people as is consistent with quality care, and where new opportunities to provide improved care are being sought, and one where there's an integrated care programme between primary care, community care and acute services. Our health system is still undergoing the most radical reorganisation and development in 40 years. The HSE is only 5 years old. Its thousands of workers deliver care in every community and in a wide range of facilities. It is gradually ending the fragmentation of policy and delivery in vital services. It is enabling the development of new services on a national and regional basis, which are already dramatically improving patient outcomes. For the first time in our history, there are targeted national strategies tackling the diseases which have had the most impact on the Irish people. Also, for the first time in our history, there is a national body, the Health Information and Quality Authority, which is overseeing and enforcing high standards. It is leading the way in exposing deficiencies and recognising progress. There is a lot of commentary about our health system, but very little of this focuses on the facts of what has been achieved. The facts show a system that is treating more people faster and with better outcomes than ever before. If you look at our hospitals alone, the number of inpatient and day cases dealt with has risen from 770,000 in 1997 to over 1.4 million in the most recent statistics. By any fair measure, an 82% increase in cases dealt with means real and sustained progress. In the most important measure of all, life expectancy, it has risen significantly, so that Ireland is now ahead of the European Union average. As I have said, there are clear problems remaining in the system. For example, in people's experiences in many A&E departments. The way to tackle these problems is to support the system in implementing reforms, not to dismantle it. The system has proven its ability to achieve major progress in many areas, and it will keep doing this. We need to deliver more responsive care to patients. Expanding the workday to 8 to 8 is an example that will allow patients to access X-ray, physio, lab services and theatres outside traditional hours. Redeployment is key to this, and that is, of course, is part of the Croke Park deal, and we believe it must be implemented. We support reform to provide a greater range of services in community settings, particularly through primary care teams and social care networks, so that patients can get services in the evenings and at the weekends. This will lead to a further increase in day case, outpatient and diagnostic activity and capacity. We are committed to reducing duplication and resources spent on administration and diverting these resources to frontline services and patients. Significant savings will need to be implemented in the health area by 2014, and most of this will be achieved through pay and administrative costs while protecting essential healthcare services. We will be increasing the charges for private and semi-private treatment in public hospitals. Prescribing behaviours will also be targeted to generate savings in drug costs. Staff within the HSE will be reduced further over the next 4 years, and this will be achieved by non-replacement and the recruitment embargo. At present, consultants, physiotherapists, speech and occupational therapists, as well as clinical nurse specialists are exempt from the embargo, and we will continue to exempt them. As I've said, our priority is to push forward with the reform of public health services over the next 5 years. The contrast between this and the policies of Fine Gael and Labour is dramatic. Their approach to all policy at this election has been to make general claims of restraint, but then to proceed with a rising series of promises which are designed to last only as long as the campaign. Their health policies have no credible costs built in, would end many local services, and would give us a decade of destructive upheaval without any quality outcomes. Their claims that they can treat dramatically more people for exactly the same cost as the current system is cynical in the extreme. They do not actually have health reform policies. They have poll-tested slogans about health designed to win votes but deliver nothing. Their proposals are different in certain respects, but they share core similarities. They would require compulsory health insurance for all. Funding would be taken from the health service and given to health insurers, who would in turn negotiate service contracts with health facilities. The cost of the system would ultimately be determined by demand. The block grant system, which ensures the availability of services throughout the country, would be scrapped. There are a very large number of fundamental reasons which the compulsory insurance models they propose would be damaging. But I would like to mention 4 of the most important. Rising costs, undermined local services, years of disruption, and the absence of quality considerations. In relation to costs, international studies have repeatedly said that our existing system is actually very good at controlling costs. In comparison, the open-ended nature of insurance-based funding either removes effective cost controls or introduces major restrictions on coverage. Fine Gael and Labour have said that they want to actually increase the care that is available rather than limit it. And the money required for this can either come from steadily rising premiums or it can come from the public purse. But it does ultimately have to come from somewhere. Fine Gael has presented the Dutch insurance model as the answer to all our problems. And what is not mentioned is that a couple on a joint income of 50,000 pays over 5,500 in health payments. Labour first published its insurance policy 10 years ago, and Fine Gael did so 2 years ago. Yet neither of them has shown how much people would have to pay for their compulsory insurance. Why is it that they can claim that their proposals are the answer to all our problems, but will not show the bottom line cost to the people? In relation to local services, the impact of compulsory insurance would be dramatic. The absolute core premise of the system would be that there would be no guaranteed funding for local services. Their funding would rise and fall solely in line with patient numbers and contracts awarded. Fine Gael has said that the block grant system, which hospitals currently rely on, will end as soon as 2014. So in 3 years' time, all hospitals will lose all their secure funding. There can be no exceptions because they say the HSE will be gone and all funding will solely follow the patient. Some consolidation of services is absolutely reasonable, but the upheaval, uncertainty and destructiveness of this policy would be immediate and brutal. What makes this more remarkable is the fact that Labour and Fine Gael candidates throughout the country are currently signing petitions guaranteeing to retain every service in every hospital in every constituency. They are promising to fight for guaranteed funding for their local services while standing with manifestos that would remove this funding. Next, there is the issue of years of disruption, which could inflict major damage on health services. Both parties have confirmed in the last few days that their plans will not be implemented during the term of the next government. Labour says 6 years will be needed, and Fine Gael says 10. Labour is proposing to end up with a health system administered by both the HSE and the insurers, and Fine Gael says that private insurers could administer everything. Even if you were to accept the absurd idea that all changes would cost the state and the public nothing, what would 6 to 10 years of radical upheaval mean for services that are required now? Finally, there is the issue of quality, about which the compulsory health insurance proposals are effectively silent. How could advances in areas such as cardiac and cancer care be achieved without strategic planning and implementation? Compulsory health insurance would cost too much, it would take too long, endanger too many local services, and deliver nothing in terms of quality. It might do well in an opinion poll, but it is no answer to the problems of our health system. And I'll ask Barry to make a number of comments as well.
Thanks, Micheál. Good morning, everybody. When I was appointed Minister for Children almost 3 years ago, I set child protection as my priority. Since then, there have been major publications, in particular the Murphy and Ryan reports, which ensured also that child protection became a very important issue and attracted a huge amount of public attention. I was given the task of preparing the government's response to the Ryan report and the recommendations contained therein. And as part of my implementation of those recommendations, we have recruited 200 social workers in 2010 in order to alleviate the very large caseload of social workers who deal with the most vulnerable children in our state. And I believe that that was a significant departure from previous practice, and particularly in the context of the recruitment moratorium. It was an indication of this government's commitment to try to live up to the expectations of the people of Ireland in relation to the failings of the past. There will be a further 70 social workers recruited in 2011. A National Director for Children and Families was appointed for the first time just a few short weeks ago, and for the first time will be reporting directly to the CEO of the HSE. I believe that the reform agenda must be continued and completed. I'm particularly proud of the free preschool year, which was again introduced last year. It amounts to an investment of €170 million in all children on a universal basis in the year before they come into junior infants. Already 63,000 children are taking part in that, and it ensures that every child has the same opportunity to develop their language skills and their personal development before coming into the primary education system. Other people have said that this would not survive the various austerity measures that have been brought in, but it has, and I believe it will thrive, and it should be expanded in years to come. Again, in the final days of the last Dáil term, I was able to secure a wording in relation to a children's rights referendum. Unfortunately, of course, we ran out of road in terms of holding that referendum before this general election, but we are committed to holding a referendum based on the wording agreed in the very near future.